And I'm guessing the next step was to reconsider or go for the surgery that you'd been pending.
Yeah.
And for you, that was lumpectomy?
Yeah, I had a wide
local excision?
Yeah, with reconstruction.
Yes. You opted for the reconstruction straight away?
It was my surgeon. He said that that's what he wanted to do, it straight away, do it all as part.
Yeah.
I wasn't prepared for what I just thought. Well, they'll just cut a little hole and take the lump out.
Yeah. It was more radical than you thought.
Yes.
And what was your impression of the cosmetic result, and also your feeling about your body in general after that?
I mean, he did an excellent job. I mean, yes, from what I had done, he did an excellent job, and yes, it you can hardly tell now from what he's done. So, and he was pleased, and so he took photos of his handiwork that he did. But yes, and I think it was a new thing that he was doing.
The technique? Yeah,
the new technique that he did.
Do you know anything about that new technique? Was it anything to do with preservation of the nipple or certain areas?
Yes, he took the nipple off and reconstructed it and rearranged the breast tissue inside. So I had a scar running all the way down and up, and then take the nipple off and replace it, and then
was it a nipple saving where they take it and then put it back?
Yes.
Yeah. So it produces a much better result.
Yes. Yes.
And that is quite new, I think.
Yeah. Yeah. It was a new technique, and you can't tell from how it's been done that that has been done.
It sounds like you're quite pleased with it. Cosmetically.
Yes.
But does that get translated into feeling okay about your body as a whole?
I think when you first have it done, I wasn't originally, because you still have a raw scar, and it's quite raised and red, and you think, well, how's this going to look?
Definitely.
But over the, it's 2-3 years now, and the scarring has faded, so it just looks like a crease line, and some of the scars you can't even see. So over time they do get better, but when you're first having it, look at it, you think, oh my God, I won't be able to go topless with that. With that, but even now you probably could get away with going, if I wanted to, get away with going topless with that.
Well, it's a relevant line of questioning, because people will be watching this, women watching this who are undergoing that procedure, and they're afraid. What restrictions will there be? Some of those restrictions may be psychological, that you don't feel confident about going out, which I totally understand.
Yeah.
And for you, did you find that you were very cautious about?
I was at the beginning, yes. What I'd wear, and making sure people couldn't see the scars so much and that. But now, unless you look really, really close, then you wouldn't notice and that. And everyone who's seen the scars professionally and that have said what a fantastic job that it's been done.
Would you say you changed your lifestyle at all because of the surgery?
In what way? For
restricting what you would do, for example, being out in the summer or going swimming, anything like that?
Probably there might be a couple of things I probably wouldn't wear, but most of the clothes I could wear, I could get away with wearing now anyway. I mean, I wouldn't go topless now. I'm at this age anyway, but yes, if I wanted to, I could do. But
it sounds like your confidence is pretty high now. I mean,
yeah,
I know time's passed, but that's also important for people watching this to see that, a few years down the line, you're effectively back to normal in regards to appearance. At least for the procedure you had.
Yes.
Of course, there's a lot of different surgical procedures.
But I do think the scar, and a lot of people, the scarring does heal and look better after a year or so down the line. You might think, well, it's going to look like this forever, but it does look a lot better after a few years.
That's good to know.